All right, so today let's talk about some surgery instruments. This is going to be a review, not necessarily in order, but just more so some of the basic instruments for your surgical setup. So, as we look around here, we can see all the different instruments that we have. So, typically, your patient is going to be numb. Then you're going to go ahead and start your extraction procedure. So, in this case, and we have a couple different variations of some of these instruments. So for starters, we have our periosteal elevator. You can see the two different variations here. I'm more so just doing a review of the instruments. I'm not going to do a complete breakdown. We have a few other surgical extraction videos put together, so feel free to watch those if you want some more in-depth information. So first, like I said, we have our periosteal elevator. We have our Bard Parker blade handle. Then this is actually where we would insert those blades for one-time use, of course. Next, we actually have our elevators. And with these elevators, they come in different sizes. So you can see there's a small, medium, and a large for the elevators. Then we have a few Minnesota retractors here. So let's see what else we have here. We have some surgical scissors, and of course some hemostats for whenever we're doing our suture placement. Speaking of sutures, we have two different types of sutures here. We have the silk, the black, and then of course we have the chromic. Removed. Then of course are dissolvable. Then, of course, we have our bone files. So two different variations of the bone files here. Of course, this is used for smoothing and shaping, contouring the bone as part of our alveoplasty procedure. So root tip picks. We have a couple different versions of root tip picks here. So you can see we have some thinner ones, thicker versions, and then of course we have our east-west, or flags as they're known, also root tip picks. We have our rongeur for kind of like a nail clippers to shape and contour that bone. We have our angled surgical handpiece and a long shaft surgical burr. We have a surgical curette, which looks like a large spoon. And then the last thing we'll get into here is some different forceps. So we have some 150 forceps and 150S. So these are obviously the pedo. Then, of course, this is the adult size, 150, the maxillary. Then we have our 151 mandibular and our 23 cow horn forceps. Now, a lot of people say, how can I tell the difference between the forceps? What's the easiest way? Some people say, well, even, if it ends in even, it's maxillary, and if it ends in odd, it's mandibular. That's a good way to look at it, but there are a couple that it's not necessarily the rule of thumb, so don't necessarily buy into that, because there are some forceps that unfortunately manufacturers have gone a little rogue with that. That's a great thought process, but it's not necessarily a rule you can trust. And then of course we have our Ash, our Birdbeak, our MD3, and this is typically used for maxillary mandibular anteriors. So, hope this surgical instrument review helps. Like I said, feel free to check out some more in-depth videos. We have a video on how to actually put together the Bard Parker blade handle safely. Then we do have a video explaining the extraction process and setup. But if there's something you need help with, or certainly would like more information on, please feel free to let us know, and we will do our best to put a video together. You can always drop a comment below, or of course you can email us at cornerstonedainstructors@gmail.com.